Hello, friends. Myself, Dr. Jhalak Gandhi. I'm a dental surgeon practicing since 10 years. I'm an expert in smile designing and I'm a consulting implantologist. I have my own clinic in Rajnayan Multi Specialty Dental and Cosmetic Laser Clinic in Shahdol, Madhya Pradesh. So today's topic is, are you taking care of your teeth? So let's check. So many of you come to know that we regularly brush our teeth 2 times a day. We all know this. Okay, so what are the things we miss out? Today I'm going to tell you all those things by which you can take care of your teeth and can keep your teeth clean. We all know that I'll show you in a cast like this. See, take a brush. Okay, take a very soft brush and put it in an angle of 45 degrees, and you can rotate it clockwise like this. Okay, by doing this, you can gently massage your gums, and you can clean your teeth. This will help in massaging the gums as well as removing the debris and plaque from the tooth surface. Okay, we can start from the posterior teeth, like from the back teeth, and then slowly and gradually can move forward uh, in a circular motion. Then on the opposite sides, we have to clean the teeth with the same 45-degree angulation on the inner side also, like this. Okay, now for the front surfaces, front teeth, on the back side also we have to clean, right? Because we generally clean on the front surfaces and we leave or the food debris is there mostly because of coffee stains, tea stains. You can find it out on the back side of the tooth surfaces. Generally, calculus or the heavy deposits are seen on the lower back side of the tooth. Okay, so we can clean it daily like this. Okay, can you see this? Okay, and on the upper teeth, we can do it like this. We can keep the brush like this, and we can do it like in this direction, in a vertical direction. Okay, now after all this cleaning, using a proper toothbrush, using a proper toothpaste, what happens is sometimes there is food lodgement in between the teeth that has been lost. Um, and we are not able to clean it because of in a hurry. So I would suggest you to floss your teeth. Okay, so now I'll explain you how you can take care of your teeth even after brushing 2 times daily. You are having food lodgement or tooth decay. Okay, so what type of toothbrush and what amount of toothpaste has to be selected for a particular age. Okay, so I'll tell you from this. When a little, when a child gets a birth, he is very small, he or she is very small. Okay, during that phase, we can start with a cotton swab. We can take a gauze piece. We can we can damp it with water, and then after feeding, what we can do is rub that cotton swab or that gauze inside the surface of the gums of the baby. Okay, so every time the mother feeds the baby, she has to clean the gums so that uh, he or she does not develop caries when his tooth erupts. Okay, so we have to make it clean. The gums has to be cleaned properly. Now after 6 months, we see that tooth eruption starts after 6 months in a baby, where we start giving him the food. We start besides feeding, we can start giving him the food like liquid food, liquid diet, and all those things, juices and everything. So at that stage, we can buy a finger toothbrush. We can see it here in the slide. For 0 to 3 years old, we generally use a finger slip toothbrush. It comes. It does not need any toothpaste. You can damp it with water, and you can clean the tooth tooth there, and the gums also can be clean with the there are little eruptions on the toothbrush in the finger. You can insert in the finger and you can clean it on the gums also. Now when the baby grows after 3 to 5 years uh, of age, when the baby is of 3 years, till that time you have to use that finger toothbrush. After 3 years of age, he can spit. He learns how to spit the water. Until that age he is not able to brush, or even if you give him the toothbrush, he most of the time the parents complain that हमारा बच्चा toothpaste खा जाता है, right? So during that phase you don't need to give the toothbrush to the baby, but after 3 years of age the baby learns how to spit, and he learns how to do the gargling and how to brush. He can have a pen grip, or he can hold the brush in his hand. So for a 3 to 5 year old baby, we can use a toothbrush which comes with a kid size toothbrush, and we can give a little amount of toothpaste which has a proper fluoride content, like 1000 ppm should be there in the toothpaste. So there are kids toothpaste which we recommend to our kids in our clinics after 6 to 9 years of age, when the mixed dentition is there. So kids need more fluoride content. So during that phase, we do fluoride application in our clinic. You can consult me in my clinic, and what can be done at home is we can increase the size of the toothpaste. Okay, kid size toothbrush comes and we can increase the size of the toothpaste. Now, when the baby is of 10 years, after that he can be given a full amount of toothpaste, like toothbrush and a pea size toothpaste. Okay, so let's discuss the amount of fluoride concentration and the quantity of the toothpaste, and how much time we have to brush in a day. So we can see here in the slide that for an age of 6 to 24 months, we give generally fluoride concentration of 1000 ppm. Okay, that is written in the toothpaste itself. You can check it out, or you can consult with your dentist also. The quantity of daily use is a lentil size. A very little amount of toothpaste has to be given for that age. After, as baby grows, we can increase the size of the toothpaste. Now, even after brushing 2 times a day, if you have a dental decay or having food lodgement in between the teeth, what is the thing that you are missing out there? Okay, so let's check. Now, there are things which causes cavities, like we do snacks in between the daytime. If you are doing snacks with an interval of 1 or 2 hours, it will cause food lodgement. It will make a biofilm on the surface of the tooth that will lead to cavities. Okay, if you are not drinking recommended amount of water in the daytime, it will lead to dry mouth. Because of dry mouth, there will be an accumulation of bacteria on the tooth surfaces, which will lead to dental decay. Now, the lack of fluoride contents. Many of the parents are not aware of how much amount of fluoride is recommended for a kid and for them also. They generally pick any of the toothpaste they like according to the flavor, and they start brushing. So, I would recommend each and every person to consult a dentist first prior, so that it doesn't lead to fluorosis. Because if we give a child a high fluoride content toothpaste, it will lead to fluorosis, which will result in lack of enamel. So because of lack of enamel, if there is lack of enamel, what will happen? The food allotment will be there. The child or the patient will lead to sensitivity in the tooth, and which will further lead to dental caries. Okay, so now we'll check. Uh, if there are caries, or if there is food lodgement, or if there is food accumulation in the tooth surfaces, what are the further steps by which we can clean our tooth in our home on itself? Okay, so there is flossing. I recommend personally all my patients to floss their teeth, because generally we take more of carbohydrate diet, which leads to a layer of biofilm on the tooth surface, and most of my patients lead to I have seen like calculus or stains, something like that is there on the tooth surfaces. Bad breath is there. Patient comes to me with complaint of they have bad odor in the when they wake up in the morning. So I generally suggest them that they should floss in the night and before sleeping, so that all the food lodgement between the teeth is also clear. Okay. We can do this flossing. See, first of all, we hold the floss in between the middle fingers. Then we take a grasp in between the index finger and the thumb. Then we put a gentle pressure, and we insert the floss in between the teeth, and we rub it against each other. Okay. we slide it like this, so that when it comes, the food comes out by this. Okay, so there are many dental flosses available. If you're not comfortable with the thread floss, there are floss like, this type of floss comes where there is a plong, and you can clean the tooth surfaces in between the tooth. But these are all disposable items, so there is no infection, or there is no harm to the tooth surfaces. Okay, there are internal brushes which comes with different color coding, so that you can use in different situations. Like if you have a very little space between the teeth, we give you a very thin interdental brush. If you have major gaps between the teeth, then we suggest you a thick interdental brush. And if you're having braces, even then you can use interdental brushes. So I will tell you, there are many situations where we use interdental brushes. Like in this slide, we can see when we generally in a dental clinic we do give bridges and crowns and dental processes. So in that processes, we tell our patients to take care of those processes by having a healthy maintenance by using interdental brushes, or they can floss, or they can use mouthwash, and later on they can also use a water jet or a water flosser. I think these interdental brushes are very good. They come very cheap and they are disposable, so they are really a good option for you to take care of your teeth. Even for patients like implants, we can give interdental brushes. Sometimes there are crowding in between the teeth, so we can give interdental brushes, but the size and the color coding has to be decided by the dentist. So I would prefer that you should consult a dentist prior to select a interdental brush. Okay, then how you can shift from interdental brush. Sometimes patients are not comfortable with interdental brushes, or they are not able to floss. They ask me that, oh, doc, can you give me a better alternative for cleaning my teeth, so that it takes little amount of time and it is very easy for me to take care of my teeth. So I suggest the best option available is a water flosser. See, in my clinic also, I do suggest this type of water flosser, where you can see there are, you know, there are options like normal mode, the soft mode, and the pulsating mode. By opting these modes, you can fill the water, you can add little amount of mouthwash in it, and then you can go near the washroom, and you can clean the tooth surfaces by placing the tip of the flosser in between the teeth like this. Okay, so you can clean the tooth surfaces by just tilting your head down, and you can floss it like this. Okay, you can just tilt and you can floss it like this. So all the food that is uh, inside the tooth surfaces or in between the tooth surfaces is clean. So I hope this video is useful for all of you. And if you want more demonstrations, you can visit to my clinic. I'll give you personally a demonstration of how to floss by the thread floss, and even also with the water jet floss. Thank you so much. We'll meet in the next video. Till then, you can subscribe, like, and share my YouTube channel with the name Dr. Jhalak Gandhi. Thank you so much.